of a medical scenario for CFR scope of practice. So I'll begin the scenario by considering the danger aspect. I'm using my SEEN acronym, so I'm thinking safety to myself, the casualty or any bystanders. I'm looking for cause, particularly any obvious mechanism of injury. I might be considering catastrophic hemorrhage at that point, and I'm looking to see if my patient is big sick or little sick. I can see at the moment my patient looks pretty unwell. I'd be looking at environment, any objects or any hazards that could impede the scene. I'm also looking for a number of casualties. At the moment I've got eyes on one. I'd also be considering any additional resources, extra resources that were required. So I'm going to start off by introducing myself. Hello sir, can you hear me?
Hello.
Okay, so my name's Ian, I'm a CFR with the Welsh Ambulance Service. What's your name, please?
Owen. My name's Owen, it is Owen.
So straight away there I can gauge that my patient is A on AVPU, they're alert, they're orientated to their environment. I can also consider that their airway is clear and they're speaking in full sentences. So I'm going to quickly establish what's going on with Owen here this morning. Owen, what seems to be the problem?
Oh, chest pain.
Chest pain?
Yep.
Have you had anything like this before?
No, never. It started when I was leaving the building site today. I was a builder. I'm a builder, you see. I came back and I just sat down, made a cup of tea. I haven't even drank it. It's just got worse and worse and worse.
So it's fairly sudden?
Yeah.
And no history of anything of this nature?
No, usually fitting well.
Okay, so we're going to reassure Owen at this point. So Owen, just try and relax as best you can. Breathe as normally as you can. I'm going to try and do as much to help you and try and find out what's going on with you, okay? So, straight away, first thing I'm going to do is pop a SATS probe on Owen's finger. So would you mind if I just took your finger and pop this on? Pop this on there, Owen. Okay. So what that's going to do is just going to check your oxygen levels in your blood. Okay. So then going to ask Owen if I can take his pulse. Would you mind if I took your pulse, please? No. I'm going to pop his arm across his stomach. Okay. Now at this moment, I'm not actually measuring his pulse. What I'm actually doing is measuring his breathing rate. So taking a quick 20-second breathing rate. Looking at the patient's chest as I'm measuring that breathing rate. So I have a breathing rate of 21. Owen's stats say 92. So what I'm going to do is offer him some supplementary oxygen. Owen, have you ever taken oxygen before? So your levels are a tiny bit low. It's going to make it easier for you to breathe if we just pep them up a little bit. So I'm just going to pop some oxygen on you, okay? So if I can just come and hold on to that for a second.
My man used to have one of these.
Just going to pop this around like this, okay? Okay, and at the moment, because of his SATS levels, I'm just going to give him some low flow oxygen, so just 2 litres to start with, leaving the SATS probe on the whole time, just to titrate to SATS. Okay. From there I'm going to move on to C. I've already felt Owen's pulse. I can feel it's a little bit fast, but it's regular, it's at a normal rate. But I might just ask him here, would you be more comfortable if we sat you in a different position, Owen?
Well, everything, I'm happy here.
Are you sure?
Yeah.
Potentially could slide you down to the floor and raise your knees.
Okay.
You may find it a little bit more comfortable. Should we try that? So I'm just going to guide Owen, so gradually down to the floor. Just take your time, Owen. Kind of lean your back on the back of the chair there. Does that give you any more relief?
Oh, a little bit, maybe.
Okay, good stuff. So from there then, D, disability. I'm not so concerned about disability. You know, he's A on AVPU, he's alert, he's lucid, he's orientated to his environment. Just there for E quickly, just to finish off my primary survey. Oh, and have you got any other injuries or illnesses or anything that I should be aware of?
You fit well.
Okay, lovely stuff. Okay, from there then, I'm going to pick into his history a little bit more. Now, given that he's got chest pain, I'm going to explore the type of chest pain that he's got. So using my Socrates acronym. So Owen, so can you tell me a little bit about more what's going on with you today then?
Just feels right there, a really sharp stabbing pain.
Okay, I can see that he's grey, I can see that he's clammy, I can see that he's beady and sweaty, I can see that he's struggling to breathe a little bit. Okay, what's that pain feel like then? Oh, you said it's a stabbing pain?
Yeah, right through to the back and under my shoulder.
Okay, so it's radiating to back
Yeah.
and the shoulder. Now, is there anything that makes that pain worse? Is there anything that makes it better?
Well, sitting down's helped a little bit.
And so you said it's radiating, can you describe what it's radiating again for me?
Just up to my jaw and shoulder, and that side there.
Okay. If you had to score the pain, 0 being the least pain you've ever felt, 0 being the least pain you've ever felt, 10 being the most pain ever, what would you score it at?
Or 5, but I got a good pain threshold. I haven't had any pain like this before.
Okay. And anything else that I need to be aware of? Okay, great stuff. So then I might dip into a sample, using my sample acronym. So I'm happy with the signs and symptoms, we discussed them. Oh, and do you have any particular allergies?
Shellfish. I don't eat shellfish.
Okay. At this point now, I'll probably grab my paperwork and start documenting some of this information. Okay. Any medications at all, Owen?
I take vitamin supplements, but no, nothing from the doctor.
Okay. What about past medical history? Is there any history of illness, recent illness that you have?
Oh, I had a bit of a bad back, and I dislocated my finger once. An ingrowing toe, but nothing too toenail, but nothing too crazy.
And no cardiac history for yourself?
No.
And what about your family?
No.
No?
All still alive, family members.
Okay, I can see you've got a cup of tea on the side there, Rob.
Yeah.
Owen, what did you last eat or drink?
Oh, I haven't even drunk it. It's yours if you want it. I haven't drunk it. I think I had a bacon sandwich with the boys on the site today. And that's about it.
Okay, and then what about events leading up? Can you describe what you were doing before this chest pain came on? Just a bit more
What was
detail
I
for me,
doing? I was
please.
inspecting someone's work, and it just sort of felt a bit of uneasy. I sort of just come over gradually, and it's just like this now, stabbing right through the back.
So you made that call to the ambulance.
Well, I did. My wife did.
Oh, your wife did.
She's gone out now.
Did they give you any advice when you made that call, Owen?
Yeah, they said chew on aspirin, but it was disgusting.
Oh, so you have taken aspirin at this
Yeah.
point, yeah. And how many did you take?
I think 3, I think.
Okay, lovely stuff. All right,
Or
thank you
whatever
very
they told
much.
me to do.
Whatever they told you to
Yeah.
take. Okay, lovely. So then what I do is then just continuously reassess. So I reassure, constantly monitoring those sats, constantly looking at Owen's condition. And I go back now and explore with a full set of obs. So again, coming back to A, his airway is still clear. Okay, he's still A on AVPU. Okay, his respirate, I'd come and take another respirate. I just come over each bit here, Owen, if you don't mind. Okay, again, not telling him that I'm taking his respirate. But this time I might take my time over a little bit more and do a full 30 seconds. How are you doing there, Owen?
Yeah, it's oxygen is helpful, good stuff.
Okay, that's good to hear. You're doing really well. There is a resource on the way. We will get some more support with you shortly.
I think I was having a stroke at one point, but the lady on the phone said I wasn't.
Okay, so record that respirate. Again, I'm taking the SATs now on oxygen. Okay, again, I take a pulse rate this time. Full and accurate pulse rate this time. You're doing great, O. Really good. Keep breathing as you are, nice and controlled.
I'm glad you turned up anyway. As I said, the missus is going out.
It's gone out, is she?
Yeah. Bingo on Thursdays.
Bingo. That's lovely. Let's multiply that by 2. That's lovely. Alright, I'll do a quick cap refill. Do you mind if I just pinch your finger bed there a second?
Yeah,
Your nail
sure.
bed. Lovely, that's returned. Lovely. Okay. Right, I'm just going to have to slide your arm onto that jacket if you
Oh,
don't
it's
mind.
fine.
I think you might
It's not my jacket. I borrowed it from them today.
Take the blood pressure.
Oh, there you go.
And do you think you can slide the arm of that sleeve up so it can go on skin? You're doing really well, Owen. Remembering, folks, to line the tubing up with that brachial artery. Ideally we're going on skin. Okay, so have you had your blood pressure taken before?
Oh, a couple of times at the GP years ago, but nothing kind of
So I know the cuff's going to get tight. Yeah, just keep that arm nice and relaxed there, okay? Doing really well, Owen. That's it, nice controlled breathing. I constantly just trying to reassure, constantly converse with the patient.
Oh, it's tight.
Yeah, we'll get a little bit tighter now. Try and
Not
relax.
as bad as this side there, it's just still really bad.
Still got a pain in. Okay. I know there's a resource on the way, Owen. On the way back down now. Okay, lovely, that checks out great.
The pressure's right there.
That's absolutely fine for the
Okay.
moment. Just keep that SATS probe on the finger there. Okay, exploring obs at D next then. Put that this side of you. Okay, so disability. Just going to check D now for disability. So could you close your eyes for me, please, if you don't mind? And open, please. So I'm just checking his pupil response. Lovely. Okay, same again, please, Owen. Open. Lovely. Okay, close your eyes one more time for me. And open, please. Okay, lovely. And then one more time, Owen. And open for me, please. Okay, lovely. So his pupils are equal round reactive to light. At this point, I might undertake a quick fast test. So Owen, could you give me a big smile, please, of the face?
I don't feel like smiling, but
That's it, show me your teeth. Lovely. Okay, that's great. Okay, arm-wise, let's pop that off a sec. Could you give my arms a squeeze for me, please? Alright, as tight as you can, both arms. Can you pull me towards you? Can you push me away? Okay, can you hold both your arms out in front of you at shoulder height, Owen? And close your eyes for me. Okay, so arms are fine. Speech is fine. Okay, so Owen is fast negative. Okay. Beyond that then, I'll take a quick temperature.
I'm feeling pretty hot, flustered somewhere.
Alright, I'm sorry, Owen. Just pop this in your ear, Owen. In and twist. Okay, temperature checks out lovely. Okay, from there then, folks, what I would do is work out my new score and continuously reassess, continuously reassure the patient, repeat obs as is needed, and monitor any changes. Thank you for watching this video. For any further inquiries about patient assessment, please follow the details that will soon follow.